times over the guidelines that they're adhering to.
Can I come in on that one?
Can I just bring in can I just finalise the questions? Paul Connolly.
Yeah, just in relation to the screening there and what's happening in other European countries, I would just like to know the costs of screening and the costs of screening, for example, a house, a school or a hospital. Obviously they must see that there's a need for these things. And secondly, would you have any evidence about the effectiveness of the screening processes that take place there? And thirdly, whether there's any visual impairment with the screening.
Thank you. Dr. Evans.
To come back to the question I posed at the beginning, obviously all of you suffer from this condition to varying degrees. Is there any way that people can be identified who suffer from this without having to go through the horrific consequences of coming in contact with the mobile phone? Is there any tests that can be done? Or are you aware of how the, for want of a better word, let's call it a syndrome, can be identified?
In my case, we'll say when Vodafone went down and I told him, he said he'd do a conductivity test on me, which he sent signals through my hands, one out the other. And he was surprised because he said there was all the signals that were going into me were staying inside me. I wasn't releasing it. I was high. Now, we got Comrade to do the same thing, and they came up with the very same results. A conductivity test, which showed it on me. Conductivity test, yeah. Now, that's what they done on me, but I mean, they didn't take it on board. They done it on me, and they said, like, they tested themselves, and they said 160 was normal, or 1.60 was normal. On the two tests I done, I was only reading 0.92, which meant that I was retaining most of the signal and the electricity that was sent through me. I wasn't releasing it.
Comrade.
Well, just the engineer for Comrade done it that day, because he says, I'll test you for your conductivity, he said. And when Comrade were down in, I asked him to do the test on me, and they done the same. Whether that can be done or not, I don't know, but that's what they put. The two results from Comrade and from Vodafone showed the same on me.
Is this test really relevant?
No, they only just had a little machine there. It is a machine that they do for testing one to see if they're breaking the wire. They can send the current through it, and the signal come out the other side. That's what they've done to me now. Whether it is relevant or not, I don't know. But the two tests they've done, will say between Comrade and things, show the same results with me. That would say the electric.
So it's an inexpensive test, like I mean.
It is an inexpensive. That's whether it will work or not, I don't know. But I'm just saying that's what the two tests they've done to me. The two independent crowds done it. Will say Vodafone done it. His engineer and Comrade done it 6 months later, and they seem to get the one result. Now, whether that be any help or not, I don't know.
In 1998, there was recommendations made to the Department of Health to set up a committee to examine these people that are electric sensitive or they're complaining, and the recommendations were never brought in or even looked at. So I mean, it has to.
Can I just ask Mr. Colbert at this point to wrap up, please? Okay.
First of all, the recommendations. Would every member of the committee have a copy of that we have submitted, so that I need, if I don't have to read them out then.
Okay,
yeah. Okay. Now on the Comrade doing testing, it's my understanding that the mobile phone companies insist on being notified. And John Ryan will tell you this, maybe too, that on them being notified if a test is going to be carried out. Now, I somehow feel myself that the levels that they are transmitting at generally are conforming to the ICTR guidelines, but these guidelines are no longer relevant. I have a document here which I submitted in my original submission from 16 scientists who met in Italy, in Catania in 2002. And that document should be available to everybody here. The screening at the moment, we've heard about screening curtains. I have one around my bed. At the moment, Margaret Cousins is investigating a company coming over from Liverpool to screen her house. We're doing a pilot project which would be just screening one room in the house, a bedroom, which would cost about €4,000. A rough estimate that would include the person coming over, doing the work, doing the measurements, and then doing the screening, which involves wallpaper, which is specially treated, paint, and a screen for the glass as well, for the windows. Now that's a pilot project. It's ongoing.
It is effective.
Well, that's a good question. That's what we're trying to find out exactly. Being the pilot project, we'll then know, yes, it's effective, or no, it's not effective. It's partly effective. And just one other comment to Doctor here. Dr. Johansson in Sweden discovered that the cells in the islets of Langerhans were being interfered with, which I believe affects insulin secretion. When Mr. Dalton was able to screen his room, he discovered that his blood sugar levels returned to normal within the room, but actually then went down or up, as the case may be, when he came outside the room. So there's a simple little piece of testing to be done there. If you screen someone, what's their blood sugar like before, what's their blood sugar like afterwards, and that's fairly simple.